Welcome everyone, and thank you for joining us for today's session, Tips to Maximize Your HSA Savings. Today's session will really be about how we can get the biggest stretch out of our healthcare dollars and, of course, out of our health savings account. Let's go ahead with today's presentation. First, I do want to mention our Health Equity HSA educational series. We do offer webinar series here at Health Equity based on the health savings account. The first of that series is the Health Savings Account Basics. Now that's really going to give you the general lines of a health savings account, what a health savings account is and what it can do for you. Today's session is tips to maximize your HSA savings. Again, how we can stretch our healthcare dollars and stretch our HSA dollars so we come out ahead in our retirement years. And lastly, we have our Health Equity Member Portal Overview. This is going to provide you with a demo, a deep dive demo into our Health Equity Member Portal and provide explanation as well as, again, demo the environment. Now you can find all of these as well as their pre-recorded and their presentation decks at healthequity.com/webinars. You can also sign up for live webinars at any time. Now diving again into today's presentation, how can we maximize our health savings account opportunity? Well, let's first touch on what the HSA is and how it can help us in our future. Now with the HSA, you have the opportunity not only to save right now, but also save for your future. Now with the savings now, your HSA has a beautiful triple tax benefit. The first of which being that your HSA contributions are tax-free. So money that you're putting into your HSA account is tax-free. Also, you're automatically seeing lower monthly insurance premiums coming out of your paycheck. So with that higher deductible, you have lower monthly insurance premiums. You also have, when you are spending your HSA dollars, if you are spending them on qualified medical expenses, again, those are going to be tax-free for you. So things such as those prescriptions, doctor's visits, those eye exams, and those dental visits, those are going to be tax-free. If you are questioning what a qualified medical expense would be, my recommendation would be to go to healthequity.com/QME. Now, how we can save for our future? How do we save our HSA and see savings from our HSA in our future? Well, the HSA rolls over year after year. Your HSA is actually tied to your Social Security number and works very similar to a 401k. If you were to leave your job or change your insurance plans or retire, these funds will stay with you and they follow you where you go. Now, because it is truly a savings account, a health savings account, you are going to be earning interest as well. This is also going to be tax-free for you. You have tax-free interest earned, and that rounds out the three of the triple tax benefit that your HSA has to offer. And then lastly, we have simple investment options. You can choose to have your money make money for you and choose to invest your HSA dollars and take advantage of that tax-free interest earned and start to invest your HSA dollars, which we will touch on later on here. You also have the opportunity for seeing doctors, networks, and negotiated discounts. Now, when spending your money in healthcare, why should it be any different than spending money in regular life when you're going grocery shopping? We want to spend our money wisely. Healthcare is going to be no different. Now, oftentimes when you go grocery shopping, you'll find coupons. You'll research between which stores have which lower costs. You can do the exact same thing with your healthcare network. It's perfect. Now, cost for a specific procedure or a medical test, they can actually vary by provider or facility, and that's even under the same health plan. So what's really great to remember is that you have oftentimes transparency tools that are provided to you by your health plan provider. It's really incredible, the tools that our health plan providers give to us. Now, especially when considering a major procedure, you're of course you don't want to spend as much money as possible. You want to spend as little money as possible on that major procedure. Now, because they get pretty pricey, of course, you want to do your research. You want to look around and see which provider is going to be as little cost to you as possible, because of course, with that high deductible health plan, you have to pay everything out of pocket until you hit that deductible. So we want to take a look and research those. Now, a way that we can do that is provide a procedure code from your provider to your insurance, to your health plan. And oftentimes they can give you price quotes. Ask for price quotes for not only the hospital, but also for a potential outpatient procedure. I had a friend who had a major procedure he had to have done, and he looked between the hospital and the outpatient treatment center that was just across the street, and he found that even though the hospital provided a really nice heated robe, he had a fantastic suite that he would go into, it was over triple the cost that it would be to go to that outpatient procedure, where he was provided with the exact same physician that was doing that procedure, as well as the exact same care. The only difference was that he didn't have a suite, he didn't have a heated robe, but it was a fraction of the cost that it would have been to have at that hospital. So when considering, again, those major procedures, you want to take a look into those little things. See if you can have that procedure done at the outpatient procedure, or see if there's just ways that you can take a look, even if you're under, in your same network, under your same health plan, there are going to be differences in costs. So you always want to take a look at that. That will help you stretch your dollars in more ways than one, definitely. Now, of course, you always want to stay in network. Your health plan provider has worked out with your physicians and has worked out those discounts and those negotiated prices for you. So if you were to go out of network, you don't have those negotiated prices and those discounts. And so generally speaking, if you stay in network, you're going to have a lower cost than you would in network. Now, spending our money wisely with generic drugs. Now, generic drugs typically cost 80 to 85% less than their brand equivalent. To me, that was kind of shocking. I didn't really realize just how much of a difference there would be between the two. Oftentimes, those generic drugs and those brand name drugs, they're going to have the exact same ingredients. They were most likely made the exact same way. One just has a brand name and one doesn't. Now, if you're comfortable with it, with a doctor, if they were to prescribe you that brand name drug, talk to them. Ask them if there is a generic alternative. You can explain, hey, I'm on a high deductible health plan. I haven't hit my deductible yet, and I know I'm going to be paying for the full price of this prescription. Is there a generic alternative? Oftentimes, the doctor will look into it, and a lot of times there is going to be a generic alternative. And so you will be saving many a dollar on just those generic drugs, absolutely. Now, how we can spend our money wisely when shopping around. Now, something else that surprised me was that there are price variations even between local pharmacies. So again, we want to take a look at our brand and generic prices as well as our local pharmacies. A way that you can compare those is by going to lowestmed.com. That's a way to compare every pharmacy that you have in your area and just make sure that you aren't paying more than you have to. Next, we also have a price transparency tool that you can use to compare medical procedure prices. A lot of times your healthcare provider, your health plan provider will have one for you, or you can visit healthcarebluebook.com. Now, you also want to shop with confidence. You want to use your HSA dollars on qualified medical expenses. Now, we also have a discount online retailer. It is called hsastore.com that helps ensure that you are purchasing those qualified medical expenses, but you're also getting really great prices on those items. Now, care facilities. This is definitely something that shocked me. It gave me a little bit of sticker shock when I saw this for the first time. An ER visit can cost up to 5 times more than a visit to an urgent care facility that will provide you the exact same treatment. Now, if you're looking at the differences between cost and these different reasons for visiting, you can see that there is a $200 to $300 difference between every single one of them. Now, oftentimes, just for walking into that emergency room, you are going to be charged $200 to $300 just for walking in, just for taking up a bed. And so it is so important that you take into consideration these care facilities, especially if you're looking to stretch your dollars. Now, for things that are minor, so you've got a minor cut, you've got allergies, a sore throat, if you feel like you have a sinus infection, those are things that you can visit your urgent care for, and a lot of times save up to 5 times more than you would than walking into the emergency room. Now, this is in no way to discourage you from visiting the emergency room, especially if you have a potentially life-threatening condition like a stroke or chest pain. Absolutely, please go to the emergency room for those life-threatening things. However, again, for those just don't feel good conditions, such as those ear infections, or you've got some really bad allergies or a sore throat, absolutely visit your urgent care. You can see the dollar differences right there. It's incredible. Again, it's going to be 5 times less than visiting the ER, so you are going to receive some definite savings there. Now, reviewing your benefits. Now, billing errors can cost you money, regardless of who made the mistake. Now, when you go to the doctor, you're going to provide them with your insurance card, of course. They shouldn't be charging you right there on the spot because, again, if you have not hit your deductible, you shouldn't have a copay. Now, from there, your doctor will bill your insurance company, send them the procedure codes, and then your insurance company is going to look at those negotiated discounts, and they're going to send you a copy of the explanation of benefits. After you receive that EOB, you will also be receiving your provider statement. So your insurance company not only sends you a copy of the EOB, but they also send your healthcare provider a copy of that explanation of benefits, letting them know what they can and cannot charge you. Now from there, your provider will send you an invoice letting you know that you owe them money. It is so important to always take a look and compare the provider statement to your explanation of benefits from your health plan. Always compare the two. Make sure you're being charged the correct amount of money. If you see any discrepancies, immediately contact your health plan to address those. Again, billing errors can cost you money regardless of who made the mistake. Again, if you have any discrepancies, immediately contact your health plan to get that resolved. The faster, the better. Now, how else can we stretch our dollars? One way to do so is fully funding our health savings account. Of course, I personally don't want to leave any money on the table for the IRS. I need that stretch out of my dollar. I need as much of it as I can to of course, get through life. Now, again, with the HSA, you can fully contribute to it and receive those tax savings. In the year 2019, we are looking at single coverage. You can contribute up to $3,500 into your HSA account. If you're under family coverage, which would be you plus one or more people on your insurance plan, you are eligible to contribute $7,000. If you are turning age 55 during 2019 calendar year or you are older, you can place the catch-up contribution, into your HSA account, which is an additional $1,000. So you can add that on to that maximum amount. Now, the beauty of this is that you are saving tax dollars. Again, contributions into your HSA account are tax-free. So if you're looking at those tax savings, you're looking at a potential house payment or a car payment or groceries or a really good down payment on a vacation. This is a wonderful way to, again, save money in your taxes. Now we're going to kind of switch gears here to healthcare costs and retirement. Let's talk about our healthcare and our retirement years. Now, when I first set up my 401k, I was thinking about all of the wonderful things I was going to do in my retirement years. I was thinking that I am going to visit my grandkids. I'm going to buy a cute little cottage out in the country, and I'm going to garden in my golden years. Now, when I was addressed with this, that the average couple needs over $250,000 in their retirement years to cover their out-of-pocket healthcare costs just during their retirement, it kind of woke me up. I was a little more aware of what I was putting in my retirement accounts. And then I was addressed with the fact that with my traditional 401k, I'm going to have to be paying taxes on those dollars. Now, if I were to take $265,000 out of my 401k, that gross withdrawal is going to be $318,000. That's a difference of $53,000 that you're just paying in taxes alone. Now, if I choose to fully fund my HSA and take it with me as a nice little nest egg into my retirement years, I can take that tax-free withdrawal from an HSA for those out-of-pocket healthcare costs during my retirement years. So I can use my 401k as my retirement account, of course, and buy my cute little cottage out in the country and garden away my golden years. And I can also use my HSA for those out-of-pocket healthcare costs that I may face during my retirement years. So together, hand in hand, they're going to offer me the optimal retirement planning solution. So I have a nest egg for those healthcare costs, and I have that nest egg for that cute little cottage out in the country. Now let's take a deeper look into those retirement accounts. Now you can see here illustrated that the HSA always has the potential to be tax-free. So money going into the HSA is tax-free. Money going out for qualified medical expenses, again, is going to be tax-free dollars. You'll also see that the HSA kind of turns into a 401k sister there. You have money going in, again, tax-free. However, if you choose after age 65, you can choose to use your HSA like a 401k. You can choose to use it for non-medical expenses and simply pay the taxes on those dollars. And there is no penalty. So, of course, it is subject to taxes, but there would be no penalty after age 65 for non-medical expenses. Now, again, you'll see here below that you have the IRA and 401k. The money's going to be taxed at some point. But again, the HSA has the potential to always be tax-free or essentially turn into a 401k sister for you. Now, as we saw a couple slides ago, we know that there is going to be expenses coming out of our pocket. We know that Medicare isn't going to cover everything for us, unfortunately. They're going to be out-of-pocket healthcare costs. Now, we have our HSA to help us out. It can pay for things that Medicare won't for you, such as those prescriptions, medical, dental, vision expenses, that includes reading glasses, hearing expenses, that includes hearing aids as well as their batteries, are qualified expenses. Copays as well as Medicare premiums are qualified medical expenses to be paid out of your HSA account. That will help you bridge that gap, fill those holes that Medicare is going to leave with those out-of-pocket healthcare costs. Now, we have potential extra fuel for your retirement years. You can start to maximize your tax-free earning potential through investing your HSA dollars. If you are interested in investing and you have a little bit of question with it, you're not really sure in the investment world, my advice would be go to healthequity.com/advisor. Let us help take the guesswork out of investing with our advisory program, Health Equity Advisor Program. Now, of course, if you are not always comfortable with investing, we have other options for you. We want you to maximize your earning potential, and we have options for every type of person. Your HSA balance, of course, it is a health savings account, so it can grow with tax-free earnings on those savings account dollars. So your interest, you have three choices here. This first choice here is a no-risk FDIC insured cash account. This is what you are automatically placed into. So when your account very first opens and you've got funds going into it, it is going into an FDIC insured cash account. Next, you have low-risk yield plus options. Now, this will allow you to boost your interest rate without having to invest them, but you are getting a little bit more interest rate out of your HSA dollars. And then lastly, we have, of course, investing. You have your varying risk mutual funds. It does carry the same risk that regular investing does, of course, but you can have your money make money for you at a quicker rate. Now let's talk about our investment advisory services. As I mentioned, if you are not as comfortable in the investment world, heaven knows I'm not, so it's totally okay. We have provided options for you. Health Equity realizes that not everybody is going to be comfortable, so we have provided our advisor program. Now, let's start with the first one, our autopilot service. Now, this is a full service fund management based on a personal risk profile. So you tell us what your comfort level is. You tell us how risky you want to be, how optimistic you're feeling about the market, and we are going to automatically start getting you in funds to start making you money. We have a certain grade that we want those funds to perform at, and so if it's not performing at a certain rate for you, it will sell you out of that fund and put you into a new one that is performing the way that you want it to. It is one of those set it and forget it type of programs. Now, because it is an advisor program, it does come with a fee to utilize it, which would be 0.08% charged to you monthly, which would be about 80 cents per thousand charged again to you monthly. The next option that we have in our advisor program is GPS. Now, it's exactly what it sounds like. You are the driver, but we are providing you with guidance. We are providing you with directions. Now, it is, again, provided for fund management that is implemented by you as the account holder. So ultimately, you're in the driver's seat. You are going to be the one who clicks on the button that says sell or buy. But we are going to say, hey, you should sell this fund and buy this one. And you are the one who gets to decide, okay, yes, I will sell this fund and buy this one. Again, you take that personal risk profile and we'll provide that guidance based on that. Again, because it is an advisor program, it does come with a small fee to utilize it, which would be 0.05%, which would be about 50 cents per thousand, again, charged to you monthly. And lastly, we have our self-driven option. This is not an advisor program because you are managing your own funds. You are out on the road in the investment world and you understand where you're going, you know where to buy and sell. You've done your research and so you understand it. This is definitely for those that are comfortable in the investment world, and my hat is off to you. Now, one option that we have that some of our members like to utilize is saving now to cash in later. You can watch your HSA balance grow. So what this concept is that you can pay out of pocket for your qualified medical expenses right now, and you can delay your reimbursement and save up your HSA dollars, have them snowball and keep earning more and more interest for you. And then when you're ready, you can reimburse for those things that you have paid for out of pocket. Now, the beautiful thing about the HSA, one of the many beautiful things about the HSA, is that there is no deadline to when you can reimburse yourself. There's no time limit that you have to reimburse yourself with an HSA. If you have paid for a qualified medical expense out of pocket, there's no time limit to reimburse yourself. So if I paid $50 for a prescription today, I could choose to wait 1 day, I could choose to wait 1 week, 1 month, 1 year, 10 years, 15 years to reimburse myself for that. That's totally up to me as the account holder. I can make that decision. And I can accumulate my reimbursable amount until I reach that determined goal while I'm building those tax-free earnings. So I can, again, let my HSA dollars sit and accrue interest and build up and then when I'm ready, I can cash that out and decide to spend it on whatever I want. Now let's talk about some tools that Health Equity has provided for you, the first of which being the mobile app. It's really convenient on-the-go access to your account. It is available for both iOS and Android. It is a free app. You would simply type in Health Equity, one word, and it will pull up a little purple symbol. Now, again, it is on-the-go access to your account where you can take a look at your transactions. You can reimburse yourself on the go. You can pay your provider on the go. You can take pictures of your receipts and documentation and upload them right to your Health Equity account. Again, Health Equity isn't going to ask you for documentation. This is truly your account, but in case of an audit, you would have to provide that documentation to the IRS. So we provide ways to make it easy for you to keep that documentation, and you can keep it with us. Again, you can take that photo of that document and save it right to your account, upload it right into your Health Equity mobile app. And lastly, our greatest and most powerful tool that we have here at Health Equity is our account mentor team. These people are wonderful. They are available every hour of every day in the entire year. So we are talking 2 a.m., we are talking Christmas morning, we are talking when you get home at 5 o'clock after work and something just went wrong with your card and you just need to give somebody a call to take a look at what the heck is happening in your account. Every single time you will have a live person answer your phone call. That is what we are here for. That is what we love to do. These people truly care about our members, and we want to help assist you with your questions and help educate you if we can. Now, this does end today's session, so thank you for attending. Thank you for watching today's session. Have a great day. Thank you.